Hello, everyone, and welcome to today's session. My name is Maddie O'Day, and I'm a project manager here at AOTA, and I would like to point out a few housekeeping items. First, continuing education. The virtual conference platform will track the time you spend in the session and award contact hours. Based upon the amount of time you spend viewing the session, you can earn up to 1 contact hour. Next, questions. On the right side of your screen, you will see a chat box. This is for you to type in questions you may have for our presenters. Our presenters are in the chat box right now and ready to respond to your questions throughout the presentation. And finally, resources. The PowerPoint presentation and any resources provided by the speakers are available to download and can be found in the box below or in the resources box on the main landing page. At the conclusion of the session, we ask that you answer 2 brief questions that we can provide feedback to our presenters. The link to the survey can be found in the description below. And now, with all that helpful information, I'll turn the presentation over to our presenters for today.
Hi there, I'm Dr. Dougleen Jackson, and I'm happy to be here with you all today to present on transition services and assessment for youth with disabilities. Our objectives for today are to first describe the role of occupational therapy in transition services, and then identify strategies and supports for occupation-based assessment in youth transitioning to adulthood. As a disclosure, I am a salaried assessment consultant with Western Psychological Services, WPS. I have no additional relevant financial interests or conflicts of interest related to this presentation. Now, a little bit about me. As I said, my name is Dr. Dougleen Jackson. I have a PhD in special education in early childhood, a master's in occupational therapy, a bachelor's in rehabilitation services with a concentration in counseling, and a diploma in massage therapy. I'm certified as an assistive technology professional through RESNA, as well as a board certified telehealth specialist. I worked in rehab for over 20 plus years, and I'm currently the president of the Florida Occupational Therapy Association. Now, a little bit about transition. Transition is defined as the process or period of changing from one state or condition to another. When we think about transition, we've been in this field for a while as occupational therapists. However, we might not always be present during those years when children are actually transitioning. I think about when someone enters early intervention and they need to transition to that preschool setting, then they continue on throughout their schooling and enter on into high school. And now we're like, what's next? It's that adulthood period that they then next transition to. We are here as occupational therapists to I often give out the poem "Welcome to Holland" so that my practitioners I work with, students I might teach, as well as the families that I work with can share this knowledge on what it is to have someone with a disability, the expectations that either need to shift or be revamped, but returning to always remember the joy in that process and the possibilities. Having a little mouse issues there, but here we go. Let's talk about transition planning. Transition is defined as the process or a period, as I just mentioned, from changing from one state or condition to another. So throughout life, each person transitions through different life stages and situations through birth, as well as into death. There's a piece, as I mentioned, that's written by Emily Kingsley on what that looks like for a family. So in early intervention, you have the transition planning phase, and we talk about IDEA and that part B, as well as part C, and what that looks like for our families. When we're thinking about the 0 to 3, they move from their IEP onto an IFSP. So this takes place during early intervention under IDEA Part C for infants and toddlers. They transition then into kindergarten, and that falls under Part B, which goes all the way from ages 3 to 21. So early intervention to preschool, then high school to post-school activities. It's all mandated under IDEA. Now, as students enter high school between the ages of either 14 or 16, with it being mandated at 16, depending on your state, that transition planning process begins with a focus on secondary transition and adult life. Now, transition services are what's there to help support and facilitate that transition, which occupational therapy can be very instrumental in. Transitions take place all throughout life. What we need to consider are our indicators. Under IDEA, there are 4 different indicators that pertain to transition. Indicators are measures of compliance and effectiveness of a state's implementation of the IDEA Part B. Of those 20, only 4, as I just mentioned, relate to secondary transition. Indicator 1 is graduation rates. Indicator 2 is dropout rates. Indicator 13 is transition in the IEP. And indicator 14 is post-school outcomes. The distinct value of OT with transition age youth centers around these 4 indicators. We have to identify what skills we can lend to facilitate successful transitions, build our competence in these areas, and advocate for our services to be included at the minimum on IEPs. Now let's talk about transition planning and services in occupational therapy. I want you to think on your own understanding of OT and how we provide services across the pediatric population. Are we just relegated to sensory concerns and handwriting? Do we fade out after elementary school? Are we afforded the opportunity to even provide consultative services and engage in program development? Consider ways that you can expand your role and advocate for opportunities for OTs to demonstrate their value with transition-aged youth. Occupational therapy practitioners are among the rehabilitation healthcare providers who can make a difference in someone's life across the lifespan. I'll tell you how I've worked in early intervention and facilitated families through that process to get their child into preschool. Now, direct services may include in the home setting following that family-centered model. Once you get into preschool, it's shifting and helping those families understand what the new expectations are going to be. As a child goes into elementary school, we want to avoid getting stuck in that box of handwriting and sensory. And we want to move on to things that are more inclusive of what we do, including social emotional development. We don't want to get stuck in those 2 areas, which we're known for, thankfully, but there's so much more as OTs that we can offer. Once they get into high school, we want to focus on that life skills training and vocational skills, as well as preparation for post-secondary education. Transition programs with adolescents focus on outcomes related to education, employment, recreation, and community living. Don't forget that community living involves self-care just as much as it does community mobility, which includes driving and using public transportation. Education is key for those interested in learning vocational skills or even going on to further their recreation is key, as all work and no play isn't good for anyone. Consider opportunities that support social participation and leisure, amongst other things. And lastly, employment, which continues to be an ongoing issue for individuals with disabilities. Consider that as of 2018, only 30.4% of individuals with disabilities aged 16 to 64 were employed, in comparison to 74% of the general population. With the current pandemic, we can only imagine what those numbers are. So what can your role be to facilitate successful transition? OT can be instrumental in creating that change needed for successful adulthood outcomes. Best practice includes helping to develop independent living skills and fostering self-determination. Independent living skills identify what's a priority for that youth and their family. It considers dependence, interdependence, as well as independence. And we need to check back in with our families to make sure we're honoring the wishes of the child as well as that family. What skills will be needed for successful transition? And what are the goals? Is it living alone or supported, post-secondary education, and or even employment? Self-determination involves advocating for themselves, problem solving, setting and attaining goals, and self-regulation. So we can be instrumental in all of these processes, and our focus should be on promoting those independent living skills and self-determination when we're working with transition-age youth. Occupational therapy practitioners are among the rehabilitation healthcare providers who can make a difference in someone's life by ensuring that we're a part of that transition planning process. When we stop and we think about it, how can we facilitate consultation? Are we included in the IEP to do that, or did we fall off early on? How can we be a part of that assessment process? Are we in the position to provide direct services? Can we help with program development? And above all else, how can we step to the plate and use our advocacy skills? A subgroup of the AOTA transition community of practice developed a PowerPoint in 2019 with 10 declarations and resources to advocate for occupational therapy services in transition from school through post-school life. You can learn more about these through the resources shared on my slides at the end, as well as looking for the Community AOTA Transition Community of Practice group. And I will go over these 10 declarations only briefly. Now, these 10 declarations follow a logical sequence, and they're divided into what you see here: setting the stage, considerations, and talking points and action steps. For setting the stage, there are 3 declarations that fall underneath. Number 1, the purpose of public education is to prepare for further education, employment, and independent living. Number 2, the purpose of OT is to promote participation in daily occupations. And this connects to those transition goals and objectives that we'd like to and need to be a part of. Number 3, many students with disabilities are not reaching positive post-school outcomes. And I shared some of those statistics with you earlier. Moving to considerations, there are 3 that fall underneath that. Number 4, there are barriers to OTP involvement. Number 5, OT practitioners, that's what OTP is, should be involved in transition, which oftentimes we are not. And number 6, transition skills can easily be incorporated into our everyday practice. It's not foreign to us. We have the skill set. We've been trained in it, whether we're occupational therapists or occupational therapy assistants. We just need to put on our hat, get out of that box of just handwriting and sensory, and do more. Show the true capacity and distinct value of occupational therapy with transition-aged youth. And then lastly, there are the talking points. Talking points include number 7, OT services are good return on investment. Number 8, best practice includes a transition planning pathway. And number 9, advocate for your role. Lastly, number 10, I can't emphasize enough, we need to make a shift in our practices. Include that advocacy. Step out of your comfort zone, learn more so that you can do more and facilitate those positive outcomes for our transition-aged youth. Now let's talk about assessments. Transition assessments take place throughout the transition planning process. This is instrumental for determining functional performance and participation as it relates to later life. It is useful for identifying roles, routines, and occupations to be engaged in, considering supports as well as barriers across the lifespan. OT assessment should be holistic in nature and consider various aspects of the client, whether they're a child, adolescent, and moving on to adulthood. Information should be gathered from multiple sources, including observations, interviews, record reviews, and where possible, completion of formal and informal assessments. This can take place with children and youth as they enter those transitional years, early childhood transitions, and many others across the ages. We always want to be mindful that the main focus of our assessments should be function. Assessments are very important to our process as occupational therapists. They can be used in a variety of settings, including schools, clinics, hospital, and community agencies. So I'm not sure where you might work, but you may come across adolescents who can definitely benefit from your assessment services. We use them to help identify client strengths and weaknesses. Assessments are the gateway to intervention and help us to provide that client-centered, occupation-based services that we're known for, or should be. As we prepare students for transitions from early childhood to school and school for adult life, using assessments is key to help facilitate occupational engagement, performance, and participation across the lifespan. These domains of occupational therapy are the focus of our assessments. For more detailed information, check out the new OTPF, the 4th edition. It's recently been updated. So if you haven't seen it already, please go ahead and do so. It includes client factors, performance skills, context, performance patterns, as well as occupations. Occupations are those meaningful, purposeful, and valuable activities that individuals, groups, or populations engage in. Client factors include our values, beliefs, and spirituality, body functions, as well as body structures. Performance skills are observable elements of action that have an implicit functional purpose. Skills are considered a classification of actions, and they encompass multiple capacities. Performance patterns are those habits, routines, roles, and rituals used in the process of engaging in occupations. These patterns can either support or hinder someone's occupational performance. Context refers to a variety of interrelated conditions that are within and surrounding the client. They include cultural, personal, temporal, and virtual factors. The term environment refers to the external physical and social conditions that surround the client in which the client's daily activities occur. With assessment, we look at all of these domains to identify strengths, challenges, and differences so that we can support independence and improve functioning with various activities of daily living. I mentioned that we want to look at the occupations of those we have the privilege to access. Our assessment provides us a window into this client's moment, the current moment, and it helps us to identify how they're performing in their occupations. Our profession is rooted in occupation. That's why you hear the word so much. And we're most concerned with performance, participation, and function as it relates to these occupations pictured here. You have play, leisure, work, rest and sleep, social participation, health management, education, IADLs, and ADLs. The focus of your assessment should be in identifying the strengths and challenges as they relate to the above occupations. This can be achieved through direct observation, interview, caregiver report, record reviews, and performance-based assessments. Assessment is the gateway to intervention. And as occupational therapy practitioners, we encounter young children, students, and adolescents who may be struggling with being successful in their role. Our role, though, is to help identify their strengths and challenges that can help to promote function and improve quality of life. We begin our assessments from a holistic view of occupational function, starting with our occupational profile. This provides an understanding of past experiences and occupational performance history, patterns, interests, values, and needs. The reason for needing potential services, strengths and concerns with regards to performing occupations and daily activities, occupational disruption, supports and barriers, and priorities are the focus of assessment. We then move on from the occupational profile to an analysis of occupational performance. And as I mentioned, it can take place through many different forms, including performance-based assessments, rating scales, interview, and our clinical observations. I'll go into those each individually shortly, and some assessments as well provided through WPS. So there's the Developmental Profile 4, the Adaptive Behavior Assessment System, 3rd edition, the School Motivation and Learning Strategies Inventory, and the Sensory Processing Measure. I just want to remind you, though, that our assessment should be holistic, meaning it looks at the whole person, considering the caregivers and the community and what they aspire to do and engage in. We want to use a top-down approach, being global in our considerations of our clients' occupational performance. And we want to be strengths-based. I keep saying strengths and challenges because we don't only want to focus on the challenges through our assessments. We want to identify those things that are supports, those things that also hinder, so that we can capitalize on what we know to help support performance and functioning. You want to be occupation-centered because our focus should be on occupations of meaning and value to our client. And then you see there's top-down. Top-down, when we look at things that are top-down, it's global in nature. And we focus on the client's participation in his or her living context to determine what's important and relevant to him or her, versus bottom-up, where we're looking at those individual small components of a client's skills. So your OT assessment should consist of the following, starting with informed consent, a records review, any intake forms you might have, or those used by your school district if you're working in the school, or the clinic. Wherever it is that you're working, you need those intake forms, and then you follow them up with your interview. Your interview can be structured to help you glean that information that's going to help guide that transition planning. Your clinical observations are key, so you can see them actually performing certain tasks. You may have some checklists, as well as standardized assessments that may be performance-based or even rating scales. I'll go into these in detail right here. So consent, did you get consent to evaluate the child or adolescent? It's important to do so. Your records review, have they had services in the past? When was it discontinued? If it has been, what's transpired since they started receiving services? You also want to look at the intake. Can you speak to the client? Who's the child or adolescent? Are there caregivers you can reach out to? Are there teachers? Can you send teacher forms to them? And any other person who can give you valuable information on the performance, interests, and participation opportunities for these children in transition. Your structured interview includes that history and background. You might have gotten some of that to fill out your occupational profile, but you can probe a little deeper into their social, developmental, medical, educational, and past intervention history. You always want to know, what are their interests? When you think about when you were choosing your career, what you wanted to be when you grew up, you thought about your interests. What was important to you? What did you excel at? What was a challenge for you? What were your interests based on past experiences of professions that you were aware of, or you might have done some digging? We can help our students do that too. How can we find out their interests? How can we adapt their interests to a career, a vocation, recreation, and leisure opportunities that they like and align with their interests? And any other things you want to find out more information about, like their sensory, motor, ADL, IADL performance, and so on. Now, when we move on to our clinical observations, they're a key component of our assessments. Have you had the opportunity to observe the child or adolescent performing tasks or engage in different activities across contexts? Have you seen them in the school setting, the cafeteria, pre-vocational training, or other opportunities to observe their performance, including out in the community? So you want to engage them in tasks that they can perform. You want to consider your past task analyses if you've had the opportunity to do so. What's their neuromuscular status? What are their gross and fine motor skills? How's their visual perception, visual motor integration, their sensory perceptions, as well as sensory challenges? So consider both components of how we use the term sensory. Next, let's look at some checklists. Are they informal assessments? Informal assessment checklists provide a valuable record for documenting a child's current functioning and even monitor progress in a variety of performance areas. Such resources might help an OT identify developmental or performance-based strengths and differences in various functional areas. Formal assessment checklists might have been required by your district or your place of work, the facility, or even funding sources. These can be valuable to inform your evaluation report, but standardized measures are also great to help provide information based on norm and criterion reference assessments. Now, I touched on this briefly on the other side about top-down versus bottom-up, but just be mindful that we want to be top-down, especially so that we can get a global picture of that student's performance and interest and help facilitate that transition process. With our standardized assessments, they're either performance-based or they're rating scales that somebody else completes or they complete for themselves. So performance-based assessments require the client to complete a specific task, often using a standardized set of objects, tools, or protocols. Rating scales include forms that you can send out for the parent, the caregiver, the teacher, and others who know the client to complete. There also are self-assessments that can be completed by that child or adolescent. They can be administered through paper, and now a lot are available to be administered electronically. You just need to check with the different publishers and see what's available through that electronic space versus those that are relegated solely to paper-based. So as mentioned before, rating scales can be sent out by paper or electronically for completion. With some publishers, you may only have a year to use what is purchased, but for those through WPS, I just want you to rest assured that these don't expire and you still get the option to print out forms if needed. And this is key, especially for families who might struggle with accessing the internet and completing forms online. You'll still get to score it online though and generate a report digitally that can be used to help plan your intervention, plan the services, plan your recommendations as that child goes through that transition process. So although this isn't a session about telehealth, it's important to consider what tools can be administered through the virtual environment or need to be mailed out. The ones I'll cover with you all today can be done so through either platform. There's a short video also on the WPS website. WPSpublish.com is where you purchase assessments, but platform.wpspublish.com is where you actually can see the video, see what's available. Right now, you can see sample manuals, and you can always request sample protocols if you're trying to consider what's going to be best for your population. I have WPS on the screen here. Remember that I am an assessment consultant with them, but I want you to know that all publishers have things available to you. Oftentimes the electronic ones, though, are only available directly through them. So check out any training, any resources they have on their websites. I found them instrumental, and I go to different ones as everyone comes to me asking which would be best for this or that. It's important to be versed in a variety of them, not just the go-to ones that you're familiar with. So I'm going to go into a few that you either may have used or they might be new to you. And then we can have questions at the end, and you can always reach out to me in contact at a later time. So let's start with the developmental profile. It was recently updated, and it now included an update of our nationally representative sample. There are clinical cases and Spanish language forms, so we're considering culture and how we can best meet our populations. The age range has been expanded, so I'm not sure if you've used the developmental profile 3 in the past, but the 4th edition now covers birth all the way through 21 years, 11 months. That's perfect for that transition age because most children, if they're staying in school, they will then age out before their 22nd birthday. Each state varies, so I recommend you check back with your respective state to see the rules and how they apply. But it's nice to know that you can track progress over time and monitor someone who might have come into the system at the age of 3. And as they continue to progress, you can re-administer this and track their progress, see what's improved, see what might have declined if they have a condition that is relapsing or remitting when it comes to their functioning. The DP4 also now includes a teacher checklist and a clinician rating form. So oftentimes we may work with a client one-on-one, and they're able to do certain things with us that they might not be able to do for the teacher or for the parent. So it's almost like we're magicians waving our magic wand, and people are like, no, they're not able to do that. And you're like, yes, they can. So this form allows you to answer the exact same questions that everybody else is answering so that you can see any variance there. This edition also has an update to reflect changes in societal practices and technology, because technology is always changing. No one's using push button phones primarily. They might still be out there. You're definitely not seeing rotary phones out there. So the skills that are needed are going to be different. The items have also been adjusted to be gender neutral, culturally sensitive, and inclusive of children who are deaf and hard of hearing. So this new update allows you to compare how the individual is functioning relative not only to themselves over time, but to their peers. And you can use the results to identify deficits, supports, and guide the recommendations for your transition planning. Now you might be curious, what areas does the DP4, Developmental Profile 4, look at? Well, here you have it. It looks at physical, adaptive behavior, socio-emotional, cognitive, as well as communication skills. So it's a well-established measure of development and functioning across this broad age range from birth to 21 years, 11 months, which definitely is appropriate for our transition-aged youth. I mentioned earlier that a lot of our assessments are available in 2 different formats. You can get it print or digitally. And if you purchase the digital kit, you can print off a form for someone who doesn't have access to the internet and then get it back and score it. You'll also get a manual, and there are 4 different forms. They're written at the 5th grade level, so be mindful of that. And there are Spanish versions, except for the clinician rating form. So the 4 forms that we have are the parent caregiver interview. So you can speak to a parent or caregiver to gather this information. There's a parent checklist, which you can send out electronically and have them send that back to you or give them a paper form. The same thing with teachers. You have the teacher checklist that they complete, and then the clinician rating form where we can provide our information and feedback. The next assessment I want to talk about is the Adaptive Behavior Assessment System. Now, this came on my radar when I was opening a hospital, and then later moved on to work at another hospital. And I often had children who were difficult to sit down at a table and do these standardized measures with manipulatives. But our funders often wanted to see numbers. They wanted to see how are they performing in reference to their same age peers. They want to see what's the progress from time point 1 to time point 2 to recommend continuation of services. So the adaptive behavior assessment system did just that for me. It refers to ways in which a person is able to meet their needs as well as deal with their natural and social demands. And by sending this out to teachers, caregivers, you can get that information back to see how they're performing in different domains, which I'll go over in another slide coming up. So these abilities and skills enable a person to function effectively and independently in their daily home, school, work, and community settings. And this assessment helps you get at that. Now, as occupational therapists, these include all of the domains that we address through assessment and intervention, including occupations, client factors, performance skills, performance patterns, and contexts. So the ABAS-3, as you may hear me call it, provides adaptive skills scores across the lifespan from birth all the way through 89 years of age. So it just doesn't stop once they leave high school. They can continue on having this completed so you can track and monitor how they're doing over time. So I said there are different areas that align very nicely with what occupational therapy looks like. The Adaptive Behavior Assessment System, 3rd edition, uses a top-down approach, which we're looking for. And once you score it all, you'll get a global adaptive composite in these 3 areas of conceptual, social, and practical domains. The individual skills that fall underneath it are as follows. So for the conceptual domain, you have communication, functional academics and pre-academics, and self-direction. Under social, you have leisure and social. Under practical, you have community use, homeschool living, self-care, health and safety, and motor and work. Now, when I earlier in the presentation talked about the domains we address, what we're looking at in our occupational profile, what we're looking at in our different occupations, there's so much overlap here that we can glean the information we need from a rating scale. One thing to note is that the ABAS-3 also has a companion intervention planner. It's a resource that links the interventions to the deficits that are addressed. Once they send this back to you and you can see where the challenges are. You address them through your recommendations. You can list out where the challenges are and come to this intervention planner and help add different things to your report so that families can go away knowing with what they can work on. Teachers can go away and know how they can support this youth or adolescent or child even in their functioning. Another assessment I want to point out to you all is the SMALSI, School Motivation and Learning Strategies Inventory. That's a lot, so I'll say SMALSI. When we talk about transition services and our role, we want to look at independent functioning, and we also want to promote that self-determination. So consider self-determination and what motivates the students that we work with. The SMALSI can be used with ages 8 and up in primary, secondary, and post-secondary schooling. It's designed for both special and general education students, and it helps to identify academic performance impeded by student motivation and learning strategy weaknesses. So it assesses constructs related to academic motivation. So how motivated are they to learn this content or engage in it? What strategies are they using to learn? And then any study habits that they may have that are either considered strengths and weaknesses. Here are the 10 constructs that the small z identifies. So if you see here, there are 3 forms. I mentioned the age range, and you can have a standardized self-report inventory for ages 8 years to 19 years with these forms here. You have the small z child form. So of course, that is ages 8 to 12. The teen form, that's ages 13 to 19. And there's even a college form that can be used. It's designed, as I said, to assess multiple constructs related to learning strategies, academic motivation, test-taking strategies, and even test anxiety. So what you see here are the 10 constructs assessed from this rating scale. You have study strategies, note-taking and listening skills, reading and comprehension skills, writing and research skills, test-taking strategies, organizational techniques, time management, academic motivation, test anxiety, as well as concentration and attention. So they've been demonstrated in literally hundreds of research works spanning at least 3 decades for each construct to be related to academic and educational success. These 10 constructs are listed here, and then they're divided into student strengths as well as student liabilities or challenges. So this is a nice rating form that you can use with your clients to get this information. Another thing that's in this package, though, is strategies for academic success. Some of you all may have expertise in executive functioning and promoting learning skills, but if you don't, there's an intervention guide that accompanies the small z that's pretty neat to have because it's an instructional handbook from K all the way through 12. It helps you identify those strategies that can help them learn how to study, help them learn how to better take tests, as well as learn overall. So there's 3 different sections, and using this intervention guide, you can pull different strategies out to help make recommendations in the context of your assessment. Many of you might be using this already or not, but if you haven't, as occupational therapy practitioners, we know that sensory challenges can be present in early childhood and persist on into adulthood. If we just think of how we go about our day and try to self-regulate, we can see the value in knowing about the individual sensory preferences and differences of everyone, not only so we can function, but so that we can also coexist. If you think of your personal nuances that impede your ability to perform your task, noises in your environment, textures, sounds, even your routine, what you need to get going, those are things that we also need to consider during those transition ages. So here I have pictured the sensory processing measure preschool, which is from ages 2 to 5 years old. And if you have a 5-year-old who hasn't started kindergarten, you'd give them the sensory processing measure preschool for the caregiver to complete. If you have someone who is 5 to 12 years old, that's when you'd have them complete the regular age sensory processing measure. And pictured here is the quick tips, because we always like guides towards intervention, and that's what this does here. So the SPM and SPM-P are an integrated system of rating scales that help assessment of sensory processing issues, praxis, and social participation. It's used in educational, clinical, research, and other community settings, and functions as either a screening tool or assessment instrument. It can help with determining eligibility for special ed and related services. It can help with planning your IEPs and IFSPs consistent with strengths and weaknesses, and it helps to measure progress as well. The results can be presented in terms that are easily understood to parents. You know, once we put on our sensory hat and start speaking our jargon, proprioception and vestibular, they start looking at us like we have horns coming out of our head. So this assessment helps put it back in layman terms so that they're better able to understand it, and I'll show you that on the next slide. It's also available in Spanish and on the online evaluation system, so you can send it out electronically. Here are the areas that are assessed using the sensory processing measure. There are 8 different skills using lay terms, avoiding that jargon that I just mentioned, and helping others really understand the terminology and connect it back to function. You have social participation, vision, hearing, touch, taste and smell, body awareness, balance and motion, and planning and ideas. And as I said, you have an intervention tool here as well. It's a great companion to the SPM or SPM-P because it helps you develop and collaborate with not only teachers, but parents as well on the sensory-based supports and strategies that we would recommend. Always keeping in mind that you want to connect it back to function. So consider, how is this student of transition age able to either function in their environment or where they're struggling, and to what component sensory challenges might be playing a role. Then you can take that information and make some recommendations on how you can explore environmental modifications, how you can look at individualized strategies for that particular student or child. And I want to let you all know that there's an update coming out to the sensory processing measure 2. What's nice to know is that the age range is going to be expanded. So I told you you've got starting from 2 to 5, then 5 up to a cutoff, right? This one is expanding that age range to cover early childhood, the transition years, and on into adulthood. So if you want any information on that, you can follow this link, register for upcoming updates, and you'll get those routinely. Now, I know that was a lot. I want to pull it all together for you so you can think about what it is to be in that transition process, mainly when it relates to that assessment piece, and then I'll review a few things on the next slide also. But here you want to start with that records review, have your intake forms to get that information, have your occupational profile completed and filled out, facilitated by a structured interview. You want to use your clinical observations, any checklists available to you, and standardized assessments that can either be performance-based or even rating scales. We want to look at the distinct value of OT and remember that we can make a difference in someone's life, not just in early childhood, but through the transition years and on into adulthood. You want to remember the AOTA 10 declarations, how you can put on your advocacy hat and make a path for your role in transition. Can you facilitate program development and what that might look like if it's not already happening? And as I said earlier, I am an assessment consultant with WPS, and we provide you not only with assessments, but training and resources. We believe in unlocking potential not just for your clients, but for practitioners just like you as well. So reach out to the various publishers to get more information on how you can be supported through transitional assessment, how you can gain access to other valuable resources, and learn more about what assessments can be used with transition age youth. Throughout life, each person transitions through different life stages and situations, from birth even on into adulthood and eventually death. As occupational therapy practitioners, we can be instrumental in facilitating transitions across the lifespan and definitely have a role in early childhood and with transition age youth. I mentioned the piece by Emily Pearl Kingsley earlier called Welcome. I'm often asked to describe the experience of raising a child with a disability, to try to help people who have not shared that unique experience to understand it, to imagine how it would feel. It's like this. When you're going to have a baby, it's like planning a fabulous vacation trip to Italy. You buy a bunch of guidebooks and make wonderful plans. The Colosseum, the Michelangelo David, the gondolas in Venice. You may learn some handy phrases in Italian. It's all very exciting. After months of eager anticipation, the day finally arrives. You pack your bags and off you go. Several hours later, the plane lands. The flight attendant comes and says, "Welcome to Holland." Holland, you say? What do you mean Holland? I signed up for Italy. I'm supposed to be in Italy. All my life, I've dreamed of going to Italy. But there's been a change in the flight plan. They've landed in Holland, and there you must stay. The important thing is that they haven't taken you to a horrible, disgusting, filthy place full of pestilence, famine, and disease. It's just a different place. So you must go out and buy new guidebooks, and you must learn a whole new language, and you will meet a whole new group of people you would never have met. It's just a different place. It's a little slower pace than Italy, less flashy than Italy. But after you've been there a little while and you catch your breath, you look around and you begin to notice that Holland has windmills. Holland has tulips. Holland even has Rembrandts. But everyone you know is busy coming and going from Italy, and they're all bragging about what a wonderful time they had there. And for the rest of your life, you will say, yes, that's where I was supposed to go. That's what I had planned. And the pain of that will never, ever go away, because the loss of that dream is a very significant loss. But if you spend your life mourning the fact that you didn't get to Italy, you may never be free to enjoy the very special, the very lovely things about Holland. So that's welcome to Holland. We as occupational therapy practitioners can help those we work with recognize the beauty in the journey, provide and advocate for our services, and use our expertise in assessment to identify supports and barriers to facilitate successful early childhood and adulthood transitional outcomes. Now, with that said, I want to leave you with some resources. Your professional associations have various resources available to support you in providing services to transition age youth. I've included some on this slide and invite you to visit the AOTA website and CommuneOT to learn more. Also at WPS, we can provide you with assessments, training, and resources too. One of the ones I like to go to is Project 10. And on their website, they have a lot of information geared solely towards transition. So if you're not familiar with them, check them out and see what information you can uncover there to help facilitate your competence and your ability to advocate for our role in transition, as well as provide services. So at this time, I'll open things up for your questions and any feedback you may have. As stated before, I'm an assessment consultant with WPS for the Northeast Territory primarily, and you can reach out to any of our assessment consultants at consult@wpspublish.com. I want to thank you all ahead of time for your time, and you can get in contact with me at djackson@wpspublish.com or find me on social media by my name or at Dr. Dougleen. Once again, thank you. And I hope you enjoy the rest of the conference.